So now we have the presentation from Thanasis Papaiooannou, professor of Athens Univ. So the floor is yours. Can you open also your webcam?
Yeah, actually, hello everyone.
Hello.
It seems that hello.
Okay.
One option is to have a quick restart. The other option is to live without the camera for the time being.
No, it's okay. Go ahead.
Okay, so thank you very much for the invitation in this very nice session and very nice, very interesting workshop. So this presentation is kind of more applied as compared to the previous ones of this session. First of all, let me introduce myself, although Monica did a very good job in that. So I'm Thanasis Papaiooannou. I'm a researcher with Services, Technologies and Group at Athens University of Economics and Business, and so a professor at the University of Thessaly, Greece, and also very greatly of very great importance at the core team of On2Chain project, as I will briefly introduce this project to you later. So what I'm going to present in this presentation, it's a more applied, as I said, approach to the whole problem of the ethics or bioethics, the ethics in the healthcare domain, by means of more decentralization and more control. And this is one of our objectives in this NGI On2Chain project, to bring to enable trustworthy data exchange and trustworthy data handling in general, also applicable to the healthcare setting. So we need the ability to effectively share health data across healthcare domain experts, and we need the ability to apply analytics, AI algorithms on top of them in order to extract new facts and to prevent or cure new diseases. So healthcare data is a very valuable source of information, but the major challenge here is how to ensure user privacy or patients' privacy, as well as their secure exchange and trustworthy handling. And by means of trustworthy handling, one of the previous speakers, maybe both of them, previously mentioned GDPR, which specifies exactly that any kind of access to the data for specific processing has to be very explicit and very specific in order to identify the processing and what kind of processing is applied on top of the data. And but we don't have the means often to verify this kind of that the law is applied in practice. Here comes the distributed ledger technologies in general and the blockchain in particular, which is a powerful decentralized technology that enables secure data sharing and access between multiple parties. And in general, as it has done already for the financial sector, to be able to secure the transfer of money in financial transactions, it can support digital health by making it easier to share data securely with patient consent across very fragmented healthcare systems. And how actually blockchain operates. And the whole idea is very simple, and it comes from the old years of the peer-to-peer systems. It's a distributed peer-to-peer network where every user has its own pair of private and public keys. And once a transaction is signed by a user using his private key, then the transaction is broadcasted to the network. It's getting into a block, and then the block gets to the miners. They solve the puzzle in order to see that the block contents can be changed together to the existing history of the blockchain, of the previous of the links of the chain. And then finally the block is added to the blockchain, and now the block is immutable and permanent, and the user transactions is complete. This is what is happening in Bitcoin, but the whole story of smart contracts, which were introduced mainly from Ethereum later on, they are also able, in this same way, we are also able to, instead of doing just mere money transfers, to execute in this distributed manner any kind of code in the form of smart contracts. And what do we do in on-chain? On-chain is the title of the project: Trust, Traceable and Transparent Methodological Knowledge on Blockchain. It's a European project under the NGI initiative. It consists of 3 open calls that distribute over 4 million euros to third-party experts through some subcontracted projects. So we attract experts in semantic web, linked data, and engineering, blockchain interoperability, knowledge management, decentralized reputation system, business models for decentralized economy, and many more areas. And we procure sub-projects. Now we are at the end of the first year of the project of on-chain. We have already procured 17 sub-projects. And as you will see later, we have already announced the call for projects, for proposals for the next year, for the second year, and you will see more details about that later. So our overall objective is to build a new software stack that merges technologies bordering semantic web and blockchain in order to enable trustworthy data and services exchange and trustworthy content handling. And this applies to several domains and applies to the healthcare sector. And what are use cases of interest that we could tackle in the on-chain project that are amenable to healthcare? So one of them is IoT security for patient remote monitoring. Another is traceability, transparency, care for privacy, and secure management of clinical trials. And as you see many more, and I'm not going to read them through because we are going to see them one by one in the subsequent slides. So there is lots of interest for use cases for blockchain use cases in the healthcare domain. So one of them, the first of them, is IoT security for patient remote monitoring. And it is one big trend in the digital health to be able to apply remote monitoring solutions for with IoT sensors that are measuring vital signs, and this data are made available to healthcare practitioners in order to practice remote care in a more proactive and preventative manner. However, security is a big deal here, and also patient data privacy is another big deal. So how do we enable patient privacy and data security, and at the same time make sure that the data itself is authentic? Also, if we have such a system in place, we should be able to identify authentic alerts that are created, trustworthy alerts that are created for healthcare conditions, like that an elderly person has suffered a fall or a heart attack. It's crucial that we are able to identify the authenticity and the trustworthiness of these kinds of alerts in order to be resilient to distribute denial of service attacks or other attacks disrupting services. So how do we do that? Or we can do that in the blockchain domain. We can use smart contracts for the authorization of IoT devices, and then enable secure channels for the transfer of data, of sensor data, and storing this data to decentralized locations controlled by the patient themselves, and the patients are able to provide access to only the healthcare providers that they want, that they allow to have access to their health monitoring data. So in this way, we enable, or the blockchain technology in general enables more user control on what can be done on one's data by third parties. But also there is a guarantee based on the registration and this blockchain-enabled registration of the IoT devices. There is a way to check the authenticity of the of the data provided into the system, and also by means of the immutability of the blockchain, one is able to check also the history of the medical data and really judge on its trustworthiness. And there are several kinds of other use cases which where we have some similar arguments. Another one is, in general, the secure sharing of health data, not IoT data per se, but health records. And not only being able to in a controlled way the health records of among different institutions, but also being able to share health records for the purpose of analytics, of running analytics on top of the data. And one way to deal with this would be a decentralized and permissioned blockchain, which enables self-sovereign data ownership in order to protect privacy, and then through channel formation to be able to securely transfer the data, and also deal with identity management using the membership service supported by the blockchain. But this is one way. I will show you another way that we enable, that we adopt in on-to-chain later. Same reasoning applies for the sharing of genetic data. It's of great importance to be able to analyze some genetic data of people, but it would be better for the people themselves to be able to market their genomics themselves, so that to be in control of their own DNA data, each secure sharing for research purposes or otherwise for analytics in a privacy preserving manner, without having a clear link between the data and the real identity of the people. So whenever I talk about IDs here, these IDs are self-sovereign IDs, some kind of digital IDs, which are not necessarily linked to the real identities of the people, which is very important for privacy reasons. And also a very important thing is that when you are in control of some data, you can get rewards in return for providing this data. Otherwise, you cannot claim any rewards. even though the data that you provide is valuable. And another use case of great importance, and we have seen how much important this can be in the recent pandemic, is to be able to check the integrity and the consistency of drug clinical trial data. So blockchain applications could enable the secure logging of the secure decentralized logging of clinical data in an auditable, trackable, and immutable manner, so that we can really help the healthcare practitioners and researchers to really check on the authenticity and on the trustworthiness of the data provided around new drugs or new vaccines or new cares that are tried worldwide. So this is, I think that this is another way of envisioning how the future health systems could perform or could be developed. So we could have patient-centric electronic health records, not having health records maintained by medical institutions alone. And these health records to be stored in a distributed storage system like IPFS. And hashes of these records or kind of footprints of these to be available in the blockchain in order one to be able to really point to this distributed data in an immutable and secure way and in an authentic way, and then to be able to really share this data. And this could be enabled in a privacy-aware manner as follows. The healthcare institutions or providers could save the patient's health records on the blockchain with the help of smart contracts, and then generate a public key, or otherwise you can call it a unique ID, which will be required for any access to the data. And if a doctor wants to access this information, then he or she must have this particular key for this data, and also patients can share their data with other healthcare organizations whenever required by just providing this key. And this is just one way to do that. There are even more efficient ways. Also, medical institutions should be able to track the experience of medical professionals. This is in general, actually, for hiring purposes of any kind of professionals. Blockchain could be of use, but especially for medical professionals, blockchain history maintained in blockchain is able to really assess the quality of the services provided by any medical professional, and helps the organizations into their hiring process. And also existing databases owned by medical institutions could be shared with other healthcare providers, or healthcare institutions could be sold, could be monetized in a way which is in a way that so that the original healthcare institutions that maintain their data maintain also the control on how they share this data, and they do not disclose this data in an uncontrolled manner, so that they are able to always benefit from this data aggregation. And also this tracking of the experience of medical professionals could be of use in case of organizations who want to subcontract some locum tenens or in emerging virtual health delivery models to inform on the medical staff experience and then allow the patients to really choose the medical experts with whom they want to actually take their services. So how do we do this in On2Chain? How we do what exactly? Patient data management, general and secure exchange. So we have one particular sub-project for this purpose, which is On2SSI for GIM. And the approach is simple. People set up sovereign identities, which are fully controlled by their owners, fully recoverable in case of loss. Identities can be generated by organizations, machines, objects. And then these entities, which can be all of this, can transactions to smart contracts on the blockchain without having to manage passwords or private keys or anything. And what they can do, they can create new credentials and they can send or accept credentials and store them in their own data vault. So in general, people can selectively receive and disclose credentials and data. And what they can do with that, for example, a patient can create identity data and share this identity data with a medical clinic, acquiring a patient ID, and then a health record is associated to this patient ID. And whenever a patient chooses to share part of his or her health data with a doctor specialization that works in the same clinic, they can do that through role-based access control, only based on the credentials that these doctors of this specialization from this specific specialization that work in that clinic have. So only these doctors are able to access the data, which it does not necessarily give access to the patient name. It could be only access to the data itself and nothing more. So this kind of credentials-based way of providing access to specific roles or to specific identities to do specific actions is one way to control the sharing of data. But also we have another project which is able to do privacy-aware health data analytics. And the whole procedure is as follows. Assume that we have some healthcare data that needs to be analyzed by data mining experts with third parties. And we need to do that without externalizing the data. Also, the data mining experts don't want to externalize their data mining algorithms or their kind of analytics expertise. How can we enable such a market? This is possible to be done through a smart contract which is executed in a secure trusted enclave, which is provided by iExec, which is one of the partners in our consortium of On2Chain. So there are some secure trusted enclaves where specific smart contracts get executed, and only these smart contracts have access to the health data and to the analytics algorithm, and they can make sure, these trusted enclaves, that the algorithm is right on the data, and actually we can have even cryptographic proofs that the algorithm has been applied on the data, and we only get back the result without anyone being able to see either the algorithm or data. And one of the last problems that exist in the healthcare is the authority of medical goods. especially, and this is very important, especially in developing countries, where actually this one, where sorry, I wanted to show you something, but apparently, okay, here. So a very big problem in developing countries is counterfeit prescription of medicines that causes tens of thousands of deaths annually. So being able to really observe all the supply chains in the medical goods is really of great importance, and blockchain can help in that perspective. And also another problematic point, or another nice use case for blockchains in the healthcare domain, is the doctor-patient communication, so that when the health records and the communication among the patients and the doctors and the prescriptions are all recorded in a mutable manner and are accessible in a controlled way to other health professionals, then the information regarding medical condition of a patient is shared more efficiently, and it reduces delays and mistakes. And we are sure that it's authentic, up to date, and medical care professionals can really act accordingly, especially in case of emergencies. So, yes, this is again related to the supply chain, how the supply chain could be changed from the existing way that it functions right now through the blockchain. You see that every involved party, like drug manufacturers, health payers, like insurance companies, providers, meaning doctors or clinics, and consumers, all communicate to each other through smart contracts that write some immutable information to blockchain, so the whole supply chain can be tracked. And how we deal with this problem in on-chain, we have this sub-project which is called POC for Commerce, which creates some hierarchical logics that describe semantics of services and products in general. And we are able, based on these ontologies, and some search engines that they are developing, we are able to do some semantic matching between services and products, and then services and products are and associated semantics are recorded in the blockchain by means of smart contracts, so that everything is logged and it has a clear meaning for everybody involved. So, as I said in the beginning, we are now at the end of Open Call 1. We are still working with 7 teams, sub-projects that will deliver the full chain framework by September 2021. We have already announced the Open Call 2, the call for the second year. And there is 145,000 euros max funding per applicant, per project. And the purpose is to build trustworthy information service exchange processes and more trustworthy content handling by means of framework prototypes. And the topics of interest are decentralized oracles, market mechanisms, blockchain interoperability and API gateways, blockchain network design and scalability, more work on semantic-based marketplaces, and also work on data provenance. So the deadlines and everything, all information is available in these links. You will get the slides later. And just also have in mind that we will have an open call for the third year of the project, giving as well lots of money away to, of course, to very high quality projects, and feel free to consider and apply. So with that, I thank you very much, and special credits to all members of the On2Chain